Hello, this is Dr. Diane Gayhart, and this is my online lecture on systemic case conceptualization that goes with my series Mastering Competencies. And this specific lecture goes with Mastering Competencies in Family Therapy, the second edition. And this is actually such a long lecture, there will be two parts, and this is the first of those two parts. When you first start working with clients, specifically families, it is very important to do what I call mapping the territory. And this is surprisingly an easy step to forget, because we often want to rush in there as counselors and therapists and help our clients and be useful and do some fancy techniques and, get the ball rolling. And the problem with that natural instinct, and I really do think it's a natural instinct. I've been training therapists for over 20 years, and I've never had someone first ask, a new therapist ask me, so how should I be viewing the family and the situation or the client? Everyone always starts with, well, what should I do? What should I say? And that's a very natural, normal place to start. But as soon as you get into this, even just a little bit, you will realize you will often feel lost. And sometimes people even use the word, I feel so lost. I'm not sure what to ask or what to do. And the reason you're not sure what to say or what to do is because you don't know what you're looking at. And I promise you that as you begin to master this art of viewing clients differently, looking at their situation, especially when working with families, being able to see the larger picture, the systemic dynamics going on, what to do and what to say just becomes painfully obvious. I mean, what really makes a therapist different than a good friend? Or, you hear about bartenders and hairdressers, who listen to everyone's problems all day long, just like a therapist. What makes a therapist different than a good friend, a shoulder to cry on, so to speak? What really makes therapists and professional counselors different is their ability to look at the situation differently and to look at the situation in such a way that they're more useful, better able to help someone navigate whatever difficulties they're facing in their life. And you will find that the better you do this, the more easily you do this, the easier your job becomes. And it becomes very clear and natural to know what to say and what to do and where you're going and to not feel so lost. So I really think this is just the most fundamental skill to being in the room. I mean, yes, we need to know how to handle, crisis situations and navigate, the laws and our ethical boundaries. And we need to know how to form a therapeutic relationship. But right up there in terms of what to do after you've established those things is understanding what you're looking at. And I think this is actually the hardest skill to develop. And I really think it's the distinction between what makes someone a master therapist and what makes someone just kind of a run-of-the-mill, therapist or counselor. And so I just cannot overemphasize it enough. And I really think it's like the last skill to come. And yet it's what makes our job so easy. So in my textbook series, I call this case conceptualization. I think it's I don't know, it may not be a preferred term, it's not a universally used term. In some places and sometimes it's called, it's a type of assessment using theory. And so, but assessment nowadays has become so closely aligned with clinical assessment and mental status exams that I use that term in my series to refer to clinical assessment. And case conceptualization is when you're using theory to conceptualize what's going on in the lives of your clients. Now, the case conceptualization that I use in this book, and it has been redone since the first edition to be more user-friendly and hopefully take a little less time to complete. It has several parts, and it is a theory, a multi-theory approach to a case conceptualization. And the reason that I have designed it this way is, the original way I started designing it this way is because I was working with university faculty trying to assess whether their students have learned the theories, and to measure the students' mastery of theory. And what I found is that when I put this case conceptualization together, it became a wonderful tool for students in their practicum and fieldwork sites working with clients to just step back and get a big picture of what's going on. And so students and even seasoned clinicians like myself can step back and use this multi-lens case conceptualization to provide what's called self-supervision, or helping you get unstuck when you're stuck with a client. And because there are all these, I think when you step back and look at your client through multiple lenses, especially if you're feeling lost or feeling there's no progress going on, you're feeling like the situation is a bit stuck, stepping back and looking at it through these different lenses, I promise you, you'll kind of figure out what piece might be missing. So, although when you first fill this out, it is a bit long, I have to admit. So you're going to start with a basic, identification and introduction to the client and a description of the presenting concerns. And then you go into the background information, which does include a history of trauma and substance uses. And then I start always with the family and client strengths and diversity, and I will go into more detail as to why. And then the family structure part goes into, is a very detailed section on the structure of the system. Then we look at intergenerational patterns, interactional patterns, and then intergenerational patterns. And then we also go into looking at solutions from a couple of perspectives, as well as dominant discourses and diversity issues using some postmodern lenses. And then we end with considering the client perspective on everything we've just written, for kind of a reflexive piece to kind of cap off the whole thing. So I'm going to now walk you through, and what I've done is I've cut and pasted sections of the online document. It is a digital document that's available at www.masteringcompetencies.com, as well as the Cengage websites. There's a student site and a faculty site for the text. And these are interactive Word forms that have drop-down menus and such. But what I will do through the rest of this presentation is, I've cut and pasted a picture of the form, and then I'll talk about how to think about it and complete the actual form. So we begin this systemic case conceptualization by simply identifying our client and their significant others. And I say simply, but this isn't always so simple. And so I just want to walk you through this just a little bit. So you can see it's separated into adults and children. And it's always useful to list here, everyone who's definitely participating in session, obviously. But even if you end up with just one person who ends up talking a lot about their partner or their children or their parent or whoever it might be, it's useful to put this information down, especially if you're working in a clinical context and you have a supervisor who needs to understand and follow your documentation. That part's really useful. So you select the gender and age. And you can select ethnicity. The actual document has drop-down menus with several different options. You can also select the relational status, which includes sexual orientation and gender identity for this form. And then, of course, their occupation. And it's important to remember that being a stay-at-home mother is an occupation, and you can list that as a homemaker. And then other identifiers. And here it is useful to put down any information that might help one better understand the client. For kids in particular, I like to put down their hobbies and interests. For example, if they are an honor student, or if they're an athlete or a soccer or whatever it is, it gives the reader, especially again if you're turning this over to a supervisor or other third party, to get a better grasp of who all the different players are in the system. And if you're working from a more strength-oriented perspective, using that other identifier section to list out important information can also help frame this person in terms of someone with resilience. Another useful other identifier to put down is their immigration status, or if they're first or second generation, because it also clues you, helps remind you and others that Immigration issues are extremely significant, especially when assessing families and family dynamics and relational patterns. So that's really critical to put down there. Other type of information you can put down there is language or preferred language. Can also be a useful information to put there for both yourself and the reader. So also as part of this section, you can use this to identify who the client is, whether it's an individual, couple, or family. And again, you can do that by just listing out certain people and then on the other identifier indicating whether or not they're actually coming or not. And then again, identifying the salient demographic features. And in terms of work, you can both put their role at work, their occupation, and the company sometimes is important, especially if you work in an area that has a handful of very large companies that have very distinct work cultures. I happen to work and have my private practice in an area with a lot of bio industry, and I can almost tell without someone telling me where they work by the problems that they're having. Sometimes on a phone take interview, I can guess which company they're working with because the company has such a distinct culture. And so sometimes even putting that level of detail can be useful depending on the context in which you're working. And obviously with kids, you want to put grades in school because that's very important information. So in this next section, we're going to identify the presenting concerns. So these are the client description of the problems. And then also the description of the problem from people from multiple layers of the system and the larger social system. Now, the way I have designed the presenting concern section of this form draws largely from collaborative therapy, where they talk about how each person talking about the problem often has a different definition of what exactly that problem is, why it came about, and what we should be doing about it. And that rather than a problem, these multiple descriptions of the situation actually become a very useful resource, or in certain cases become a very useful resource for the therapist or counselor in terms of understanding what might be going on and how to proceed, and especially if things don't work out the way that you expect them to, or something unpredictable happens. It can be very useful to go back to these multiple descriptions. And another important part of this is for you as the therapist or counselor to be very aware of how each person is defining the problem. And I think it's very important to flag that, and I'm very conscious of this as I even talk to, especially if I'm working with a couple or a family, to make sure that I'm honoring each person's perspective, whether they use a particular word, such as, using I have major depression versus feeling blue versus just not myself, or, some people can actually take that same thing and call it a form of defiance. So whatever that might be, to be aware of how people are defining and describing it, because it helps the client feel understood, especially when you're working with two or more people in the room. If you align with just one person's description and definition of the problem and ignore the other person's, that other person is going to probably not be as involved or on the same page with you and the other person, and kind of feel like you're not agreeing with them, and they're going to probably not be as cooperative and or invested as you would like in the process. So it's really important to keep that in mind. And so sometimes I will literally ask, like if I'm working with a couple and one person might see it as, a communication problem, and another person, might define it very differently, I would actually try to, ask similar questions, but using each person's language when I speak to them, so that they are very aware that I'm respecting and honoring their particular definition of the problem. The classic with a couple is the nag withdrawal, so one person saying their partner's nagging, the other one says, no, the problem is my partner withdraws. And so I will very consciously define and ask questions using each person's set of vocabulary. And so when you're filling this out on the form, it's very, of course, important to include the description of each person in your room, in the room. But I find it very enlightening to also ask them, whether I'm working with an individual, couple, or family, for how other people in the who might know about the situation would define it. So how is their extended family defining it? It's great when you've got a teen, you're working with a teen maybe individually or with their family. You know, how would your parents define it? How would your younger brother and sister? How would your aunt and uncle or your trusted grandparent? Whatever it is, it's often very enlightening. I think it's most entertaining and enlightening with an individual, because often they're very aware of how other people are defining the problem differently. And then also, especially to look at, like, if you're working with a child or teen who has a problem at school, how would people at school define it? How would someone at work, if you're working with adults primarily that are employed, how would their boss or a coworker describe the problem, or whatever it might be? And so this is very useful and insightful, and I think you gain a lot of information by getting multifaceted, multiple persons' perspectives about the presenting concern. And rather than trying to shepherd everyone to one concrete definition, to kind of allow some of this fluidity, gives you a lot more maneuverability as a clinician, especially if your first, line of intervention doesn't seem to be working. So the next section of the case conceptualization involves getting background information related to the client and presenting problems specifically. And here we're going to collect and document information about trauma and abuse history, substance use and abuse, any precipitating events, and also related historical background. So when documenting the background information, you can start with this history of trauma and abuse. And most people put this in some kind of intake form that will collect this history. It's also very useful because this is a very personal, intimate thing. And some people are actually more comfortable putting it on paper, and other people are more comfortable saying it out loud. And so it can be useful to try to gather information in both formats. And so this is one where typically at the beginning of treatment, it's good to ask both in writing and verbally about any trauma and history. And still with that, it may come out later, and later, once they're gained enough trust to tell you about their abuse history. So you can ask in the beginning, you can do it on paper, you can do it in your first session, and it still may take many more weeks or even months before the full trauma history or abuse comes out. And part of that isn't just a willful defiance or embarrassment or intentionally. The nature of trauma and abuse is to forget it. And so sometimes it just takes time. And so just know that because you've asked once or twice, there may still be a history there. And the nature of abuse in certain cases is that it's not easily retrievable. It's not an easily retrievable memory. And then next is substance use and abuse. Similarly, substance use and abuse is one that's very difficult to get an accurate history of. And so again, you can ask on paper and verbally, and you still may find 2, 3, 4, 5 months later that there is some kind of either current substance abuse issue going on or history of it. And so again, just know that you'll revisit this more than once. Then you want to move on to precipitating events. And so especially if your clients come in and the presenting problem isn't something clearly like there was a crisis situation, suddenly I'm depressed, or suddenly, panic attacks are starting, or suddenly we're starting to argue a lot as a family, or my child's, grades dropped, or whatever it might be. You want to ask about events leading up to this, any major changes, anything, change in, a month or so before this happened. And so that's useful to get to document those. And often clients have put, connected the dots and can list these off for you. And sometimes you need to ask a little bit more. And then it's useful to also document any related historical background to the presenting problem. It's very possible something like depression can be very recurrent, and so you might want to document past history related to that, or domestic violence can often be a recurrent pattern. So you might want to get history related to that. And so that just takes you asking some questions and to get some of that background. And again, you might want to follow up, if you do it on paper, to also do some verbal interviewing around that background. So the next section of the form has you list out the client and family strengths as well as related diversity, resources, and limitations. You know, there's a lot of talk nowadays about, strength-based counseling and diversity and such. And it's interesting because it is one of those things that is actually more difficult to do than you might initially think, because most of us, including clients, we come to the process of family therapy, psychotherapy, counseling with the idea that we're here to solve problems. And so you come with this very problem frame of mind, and so actually identifying strengths and resources can be really challenging. The one thing I did learn is that one of the first things, and the reason I put this before we get into kind of identifying, problems in the family structure and interactional patterns and all that good stuff, is that when you wait till the end, and I used to have this section towards the end of the case conceptualization because it naturally goes more with the postmodern approaches. It's probably, it's like solution focus. They're really this is their primary area of assessment. That when I did that, it was interesting because I would read through this whole assessment, and it's long, and when you type this out, this 4-page document gets really long. I would read through this whole thing, and you begin to kind of like feel pretty helpless. You're like, God, the parental hierarchy is a mess. There's no parental coalition. There are triangles left, right, and center, and blah blah blah. It went on, and you'd feel kind of hopeless. And then sometimes I'd hit this strengths and resources section at the end or towards the end, and I'd be like, oh my goodness, this is amazing. This kid, is actually an honor student, or this kid, is super helpful, with their younger child, or whatever it is. And I found that it changed my whole perspective of what the other listed, areas of assessment were above it. And so for that reason, I have moved it to the very first thing that you do to help you keep in mind those strengths and resources, because I think bringing a positive and hopeful attitude to our clients and how we view them makes our job much easier, makes them usually feel much more hopeful and energized and willing to do something different. And so I really think this is an important section to spend some meaningful time with, so that there's a natural tendency in the mental health field, because we get paid to solve problems, not identify strengths and resources. So there's this natural tendency to get really good at finding everybody else's faults. And so we really need to counterbalance that with a very conscious effort at focusing on people's strengths and resources. So when you begin trying to identify an individual or personal strengths or resources, you want to look at both their abilities and their personal qualities. So in terms of abilities, you're going to look at the past, present, or future. And so this could be often in terms of hobbies, or you can look at their work or school, being just ability to form friendships. Figure out they are doing something with their days. There's something in their life that they find interested in and put energy into and are good at. And so you want to learn about that and to track these. I mean, sometimes people have strange, or maybe not strange, but kind of not so flashy or exciting things, like they were a great athlete in high school, they were a great musician, when they were young, or do that as a hobby, whatever that might be. I mean, things such as being an athlete can often, you can go and use that to connect and build new relationships by getting back into some form of sport, or to use exercise and fitness as a way to help manage depression or anxiety or stress. So, what may seem like kind of innocuous, run-of-the-mill things can be very, very useful in the hands of a good, skilled clinician who knows what to do with that information. And so also in terms of personal qualities, there is a little chart in my book. It's very interesting because virtually any quote-unquote problem, characteristic, or flaw, or situation that's going on has what I call a shadow strength. So what that means is that whatever you're doing in one context that's causing a problem, if you took that exact same tendency and put it in a different context, you are likely to have that work, because almost everything in life is a double-edged sword. So one of a classic one is anyone who worries too much. So many of my clients worry a lot. I also know that they're likely to be very diligent and very productive. And I have one of my clients right now I'm working with. We always joke because she is just an overachiever and diligent, and she's so hard on herself. So I know if I give her a little homework assignment or something to do, we know she's going to do it. We always joke, at least the one thing I know, you're going to worry about not doing this, so I know you will do it. So we always have a good laugh about that, and because she always follows up on whatever I tell her to do, which is part of her problem. And so I use that information even as a clinician to be very careful and cautious, and to use a lot of almost paradoxical intervention in terms of assigning her, to relax, those sorts of things. Because I know she will do something, because that is the shadow side of her strength, of being overly diligent, pushing herself way too hard, worrying too much, just being way on top of way too much. So whatever it is, if you're depressed a lot, research is very clear that people who tend to be depressed tend to be more realistic in terms of their assessments of themselves and life and things that are going on. And they tend to be deep thinkers and thoughtful, reflective people. And as you bring that attitude as a clinician, and you begin to see these patterns, I also think you're able to tease out and identify those strengths, and then help clients learn how to channel that tendency in much more positive directions. And then you want to spend some time thinking about their relational or social strengths and resources. And so these are social support networks that can help clients either physically, emotionally, in terms of the community level, and even at a spiritual level. And so you want to also identify these and how they can be useful to the client, and what resources they can have might be there for them to help deal with whatever is going on in their life. So, even having one good friend on this planet, I think, is one of the most precious resources there is. And so identifying that and listing that, and I think encouraging clients to build and use those relationships to get them through difficult times can be very useful. And or having family who is able to support them or help them in one way or another, whether it's financially or helping them with tasks, or just even being there to hang out with on the weekends. I mean, those are very important functions and roles that our families provide for us. And so being aware of those as a clinician is very important. So this next section is actually one of the more difficult sections to fill out on the case conceptualization, because it invites you to identify diversity elements related to the client, which could be racial or ethnic. It can be religious. It can, everyone has some form of gender and social economic diversity. Whatever it is, it could be even physical ability, or having, whatever it might be. You want to identify some of those diversity elements, and then identify both the resources and the limitations that might be related to it. So some of the common resources due to diversity could be a strong social network, because many, whether it's an ethnic or religious, or even a support network for someone who's been diagnosed with autism or a physical disease such as cancer support groups and such. So those are very important to identify that as a potential resource, if it's not one that the client's not drawing from already. And so you can also look at diversity. There are often different sources of community and connection that one can find both purpose and direction in one's life. There can also be resources for problem solving within a given community, such as many religious cultures and traditions have unique resources for problem solving that clinicians should be aware of and consider drawing upon. Beliefs that provide comfort. That's another very important resource that can come from one's background. And as well as access to social services. Sometimes That also is a new resource that becomes available to somebody. And then you also want to look at potential limitations, such as experiences of harassment and or discrimination. And this can be not just based on ethnicity or sexual orientation, but even being a woman working in a male-dominated field or a male working in a female-dominated field. It can go both ways. So looking for those sorts of things. Looking for where they might feel isolation or difficulty meeting others. Difficulty finding opportunities or accessing needed services. Having difficulty communicating, especially with large bureaucratic institutions, can be very challenging. Just a lack of resources. So no, even if you want to say your client is a white middle class Caucasian and there is no diversity, I challenge you to look a little deeper, because given their gender, social economic class, and the region that they're living in, and or you can look at things as subtle as even their occupation and how that fits into the larger community where they're living. I want you to step back and think through this a little bit and try to identify some of the unique resources and or limitations due to diversity. And like I said, it can be a little challenging at times, but I think when you put some energy into this, it's very eye-opening. So the next section we're going to talk about describes family structure, and as a systemic case conceptualization, this is definitely going to be the largest and longest section. And so we're going to start, you can see here we start with just identifying the family life cycle stage, and we'll go into that in a little more detail, and then it moves into the typical style for regulating closeness and distance within the couple or the family. And so you can answer that whether you're working with an individual couple or a family. And then we move into the structural therapy boundaries with and between a system. And this section continues by identifying triangles and coalition, looking at the hierarchy between parents and children, and then moving into complementary patterns between parties in the system. And then we go into Satir communication stances. And the final section, the Gottman divorce indicators, actually gets picked up in part 2 of this online workshop. So conceptualizing family structure is very important, obviously, when working with couples and families. And I would argue that it's even more important when working with individuals. Because when you work with individuals, they really just bring in their perspective of what's going on. And all of us function within these larger systems. And when you begin to see how an individual's problem kind of fits into the larger systemic dynamic, often it significantly changes how you as a clinician might want to engage. Because we typically tend to see our own perspective, and we all tend to have blinders on. And so it's very helpful because the systemic assessment helps, I think, clinicians really work with individuals much better, because usually with couples and families, they will correct each other's misperceptions of reality, or what they perceive to be misperceptions of reality. But at least you get multiple perspectives of what's going on, so you get a bigger picture automatically when you work with couples and families. But with individuals, you can really be missing significant pieces of the puzzle, and that's why this going through and identifying the family or relational structures around an individual really help you better conceptualize what you're doing. And so in large measure, it is more important to do this with individuals than with couples or families, where they do kind of self-correct each other. And as you can see here, this, as I mentioned on the slide before here, we're going to go through the family life cycle stages, boundaries, triangles, coalitions, hierarchy, communication stances, and the divorce indicators. Now we start with the family life cycle, and there are several models of this. And you can see I've chosen to use a fairly detailed one. And the importance of the family life cycle and just identifying this with your client is that certain problems tend to go with certain phases of the family life cycle, just like when you look at individual stages of psychosocial development or other developmental theories, there are certain challenges that we are supposed to all go through and master or end up typically struggling with. And so this can just be helpful in zeroing in on what might be going on. And it's very common when working with families that they get stuck transitioning between one stage and another. For example, a real common one is transitioning from families with young children where one style of parenting and one type of relationship tends to work, and then transitioning to families with adolescent children. And oftentimes when families come in where they're getting stuck with their tweens or early teens, I'm like, so you're doing what you used to do when they were young and nothing's working anymore. And they're like, yeah, how did you know? And it's like, yeah, family life cycle stuff. So this is a really useful and a great first place to start when you're looking at family structure. And so the list of stages includes leaving home, becoming the single adult, and this is where a person works on learning to take care of themselves and being independent. And so this is a phase of great independence. And in modern American culture, this stage is definitely expanded significantly over the last several decades. And so whereas in the past getting married, in your early mid-20s was very normal, it's certainly stretched out to much later. The average age of getting getting married and or long-term committed partnership, and then also the age at which people are deciding to begin their family and have children is also much later in life. And so this is actually a pretty significant life stage for a lot of people. Then there's the committed relationship, where you learn to develop interdependence in terms of, so you're less independent than you used to be, and learning how to form a partnership, which requires coordinating behavior with someone else, which is always challenging if you haven't figured it out yet. And then there is families with young children, where these adults who not too long before often were very independent, they became more interdependent, and then once with young children who were highly dependent on their parents, this is a phase where there is the least independence usually for the adults, because they need to adjust to meeting the needs of young children. Then as you move into families with adolescent children, there is the adolescent children are becoming more independent from the adults, and the adults need to adjust their relationship and the level of hierarchy and the boundaries within the system in order to transition to this phase well. You also have the potential for divorce interrupting some of this, and or blended families, where you can have multiple life stages going at one time, which is part of the reason it's so complex. Often the dynamics within a blended family, and why there aren't any real hard fast rules about what blended families should be doing. Then there's the launching of children phase, which can be particularly difficult for the parents, particularly if you had a mother or a father who was at home taking care of the children as their primary job. It's obviously going to be a major life transition for them. And then there's family in later life, where children often become quite shocked to discover that they need to be taking care of their own parents, which is something in our culture which varies dramatically across cultures, actually, in terms of the expectations of families in later life. So boundaries are a very useful concept to keep in mind. This concept has kind of seeped into the kind of popular vernacular discussion about relationships and families. And it comes primarily out of structural family therapy. Salvador Minuchin, I think, was the therapist that most people recognize as really conceptualizing this in a clinically useful way, these ideas. And boundaries, we use as shorthand of being clear, diffuse, or rigid, but they are much more multifaceted than that, because they really are the rules for regulating closeness and distance within a family. And these are highly informed by cultural norms as well as gender norms. And so it's important to keep that in mind as you're working with families, what looks like a clear or diffuse boundary in one culture, in one family, along gender lines, it can change quite dramatically too, even within a given family. So keeping that in mind is very important when you're trying to assess boundaries. So when assessing boundaries, we generally use the shorthand form of clear and diffuse and rigid. And within different subsystems within the family, these can vary, and typically do vary. It's rare to have all diffuse boundaries between all the subsystems or all rigid boundaries within all the systems. It's more common to have diffuse boundaries. One of the classic family forms is a diffuse boundary between the mother and the children, with the father having more rigid boundaries either with the children and or his spouse. So that's a more classic way that this might look. There are some cultures and some families where I have seen pretty much diffuse boundaries across the board and or pretty much rigid boundaries across the board, and that's common. So when we start looking at clear boundaries, it's really important to keep in mind that there's a lot of cultural variance. And the main thing here is, are there problems emerging within the relationship? Because if there are, there generally are some kind of boundary issue going on. So if you just go clear down with all the, with everyone in every system, that's kind of a red flag in terms of then why are they here, what's going on. There must not be too many relational concerns going on. And so I just encourage you to sit back before you want to click everyone off as clear boundaries. That would generally mean things are pretty smooth sailing in most all relationships. And so it's important to remember that in collectivist cultures, there's going to be more closeness. And you can have there's a wide spectrum. You can have clear boundaries where there is more closeness and cooperation and open communication, and you can have other forms where there's a much greater value on independence and more individualistic cultures. And you'll see family where there's a fair amount of greater independence, and that can be healthy. And the question always is, are there problems associated in or coming out of these relationships or related potentially to these boundaries? And if there are, then that's a problem. And if they're not, then they would be considered clear boundaries. So with diffuse boundaries, we have these enmeshed relationships where the couple or the family tends to overvalue togetherness at the expense of respecting one another's individuality. So a classic example of this is, a person has a different opinion on a given topic, and their partner gets all angry because the other person sees things differently. And that's a pretty consistent pattern, that when anyone has a different opinion, the other person is hurt because they don't agree. And you do see that quite a bit. And you also can see where anyone has a problem, then everyone else is upset and flustered, and it's hard, because, one person is depressed, it's hard, or upset about something, it's hard for everyone else to relax and be themselves. So that's one, and that becomes to such a degree that it is problematic in one way for either the individuals or within the relationships. In terms of rigid boundaries, this is when couples or families privilege independence over a sense of cohesion and connection and a sense of belonging, to the point where people don't even know a whole lot about what's going on in somebody's life, or someone's feeling lonely or detached or like no one cares. So those are the more rigid looking boundaries within a system. It doesn't necessarily mean someone's rigid in their personality. It just means that there is too much independence and not enough connection and togetherness, to the extent that someone's experiencing some kind of either individual symptom like anxiety or depression, or that relationally there isn't a sense of connection. Triangles and coalitions are very specific forms of boundaries and or specific forms of subsystems, and they're generally considered problematic. And the idea here is that there is tension between two people that is resolved by drawing in a third person to stabilize that original dyad. And some people, not everyone, but often you can even consider an inanimate object like drinking or work as actually serving a similar purpose. And there is some variation across theorists as to whether or not they use things other than people in terms of that dynamic. So in terms of triangle and coalitions, these are particularly noticeable in families that are having conflict. And Minuchin in particular has clinicians look for cross-generational coalitions. So when one parent has sided with one or more children against the other parent, and that's very common. In fact, some families are just very aware of this. It's almost like there are two teams in the family. So it's a very important dynamic to assess. And the ways that you can assess this is sometimes clients will, like I said, overtly describe these roles and how they're when they're describing the tensions that are going on. Sometimes there's a confidant. They identify someone as a confidant, or when a problem erupts, the pattern might be they go and talk to X about it, and that kind of creates that triangle. And sometimes a person is fulfilling an unmet need through a third party. So, for example, like I said, one of the classic family structures in at least American society is a mother who spends more time with the children, develops more close intimacy with her children than with her husband, who was working 12-hour days to support the family. And so that's a form of triangulation. And oftentimes when therapy just gets stuck, especially when you're doing work with a couple and or a family, you will find that there is a triangle at work that may not be fully acknowledged, and that is why you're unable to, in therapy, get the relationship that's in the therapy session to shift. So it's important to really identify these triangles and coalitions, because it's one of those things where you begin to realize that if you actually make the change that they're asking for, it creates a shift in another relationship, and so it becomes a much more complex puzzle. Now, when parents come in complaining of problems with their children, most always you'll find there's some problem with the parent-child hierarchy. And so this is, I think, one of the most useful areas to assess, no matter what clinical approach you're working with, when someone is coming in with a problem with a child, whatever that might be. And so the question you always need to ask yourself is the hierarchy developmentally and culturally appropriate? And that can sometimes be a tricky question to answer. And generally, if the child is having problems cooperating, listening to the parent, is having problems at home, in almost any form, there is a problem with the hierarchy that needs to be addressed. So when you're assessing hierarchy, you can broadly identify a few different categories. One is an excessive, there's too much hierarchy that is not appropriate developmentally or culturally, and so there's too much rigidity there, and so the parent needs to reduce that and allow a little more independent functioning for the child. Insufficient hierarchy is when there isn't enough, and I would say the majority of clients I work with in suburbia area of Los Angeles, insufficient hierarchy tends to be the more common than excessive, and that is when the parent is not able to have consistent and effective limit setting with their children, whether it's around homework or how, being respectful or whatever that might be. And our culture at the moment seems to be favoring a more gentle forms of parenting that allow children to express themselves and have rights, which is all good. And oftentimes what goes with that is parents not setting a sufficient number of limits, boundaries, and consequences to be effective in terms of managing their own children's behavior. An effective parental hierarchy would basically generally indicate that there aren't really problems in this area in terms of the children are functioning well at school, they're functioning well socially, they're functioning well at home, they do have close, meaningful relationships with their both parents. And then inconsistent means that this is someone who might flip-flop between being super harsh and then not parenting very much at all. And that's another very confusing one, that they go kind of back and forth between the extremes. And so, as you can imagine, that's even a little more confusing for the kids. And so, uh, one thing to you can help parents think of is identifying what their business roles are versus the personal roles are. And the business side of parenting is setting those limits and consequences and helping children to be successful in what they need to be successful in, which is, in our particular culture, is generally functioning well in school, in social settings, and being a pleasant member of the family. And whereas the personal role is that almost like it's more of a friendship or a mentoring relationship, but a more heartfelt connection with the child. And that personal side is really where the respect comes from in a relationship between a parent and child. And so helping parents to nurture both of these, with the business roles more kind of in line with what we're calling the hierarchy. And we'll be talking about attachment also, which often connects more to the personal side. Now, complementary patterns have to be one of my favorite things to assess in systemic assessment, because they are something that most people miss, and these are counterintuitive. And the idea here is that within a couple system or a family system, any close, intimate relationship that's created patterns and has formed a system, that complementary patterns typically evolve, where people take kind of opposite roles or functions within the system, and then when this becomes exaggerated, they become problematic, when these become rigid. Some classic examples are the pursuer and the distancer in a relationship. The pursuer is the one seeking intimacy and connection. The distancer is the one pulling away from it. In normal, healthy relationships, this can flip-flop to a certain degree, or at least is kept to a acceptable, comfortable level. When these become very, very rigid, it becomes very problematic in a couple relationship. Similarly, you can have people who appear to be the emotional one versus the logical one. And when this becomes extreme, it can become so extreme that each individual actually almost loses touch with the fact that they have both an emotional and a logical side. And it's almost like, no, my partner's the logical one, I'm the emotional one. And this becomes a point of continual conflict, to the extent that people begin to build their identities around it and lose touch with that own natural ability within themselves. Also with parents, you can get the good parent, good cop, bad cop type thing going on. And again, these are not these at a minimal or low level can be okay, but often by the time people are coming in to see a therapist or a counselor to help them, generally these are gone to extreme levels that need to be addressed. And I think these are so much fun, because often as these begin to shift, people rediscover within themselves these capacities that they had labeled on their partner and labeled as a bad thing, and they begin to realize that they too are capable of this, that they had just got it into a very unbalanced or imbalanced pattern that was with these complementary extremes had developed in the relationship. Another element of this case conceptualization that I include is Satir's communication stances. And Satir identified these as communication stances that a person takes, not when they're having a great day and everything's going fine and everyone's in a good mood and we're all able to get along, but when tension arises or when stress arises in a relationship, what does that person do? What is their strategy for managing interpersonal distress? And she identified 5 basic communication stances. The first is placating, in which a person kind of is very quick to ignore their own needs and wants in order to take care or to focus on the needs of someone else. So these are the peacemakers, the people pleasers. And so when tension comes in a relationship, the placator is the one who is generally trying to appease their partner, and definitely find it very stressful to have that kind of Cold War tension going on. They can't handle it. They need to be the one to come back and let's talk it through because it's very stressful on a placator. Placators do tend to get in relationship with blamers, and blamers are the ones when they feel threatened in a relationship, they go into attack mode, either in their head, but very often verbally also, where they see it as the people out there aren't doing what I need, and they're very focused on how the outside world is not doing what they need. And so quite often placators and blamers do end up in relationship with each other because they're it's a complementary pattern. And so that tends to balance it out, and they are able to, find balance and harmony there. Another pattern is called super reasonable, and super reasonable refers to when a person feels stressed. What they default to is acknowledging or focusing on some kind of external contextual source of reason, usually some kind of contextual outside system of thought to which they appeal and focus on. So they're not focused on either individual subjective realities or feelings or needs or wants. They look to some set of rules. So this can be religious doctrine, and they look at the religious doctrine to the extent of, well, this is what the Bible says, and so what you and I are thinking and feeling is irrelevant, to use the next word here, and minimize what the individual lived experience is. Now, this doesn't mean that anyone who might, look to either the law or to some kind of religious, doctrine for guidance, that's not the problem. The problem is that it's a very imbalanced way of doing it. Super reasonable people, Satir originally called these like the computers. They're so rigid and they're so in their heads, and they have a very difficult time even identifying and verbalizing what they want or what another person might want, and to understand and acknowledge that subjective reality. So empathy is very difficult both for other people and even for themselves. So this is a very unique stance. These tend to be not very emotionally expressive people, and very much what we often call in the vernacular, living in their heads. And the fourth type here is the irrelevant type. And this is a type that when pressure comes on, when there is stress in a relationship, when they feel stressed out, their coping stance is to become irrelevant. What that means is they try not to acknowledge their feelings, the feelings of others, or even what's appropriate for the context. And so these are the class clown who is making jokes, or someone who is making, we're having a very serious conversation and all we can get out of this person are inappropriately, or at least inappropriately timed jokes and comments, and they can't stay in very deep, heated conversations, even if they're not angry very long. There's too much tension there. And so the irrelevant type is always kind of avoiding any type of tension, usually with humor and random comments or silly behaviors, that sort of thing. And then finally we have the congruent communication stance. And so this is what we strive to teach our clients how to be whenever they are having a difficult communication with their partners. And so someone may be congruent most of the time, but the question here is, especially when we're assessing Satir communication stances, is where does this person kind of default to? And someone, it says the congruence is always the goal, and for someone to be able to maintain this stance even when their partner is angry with them, and that would be the correct time to check this box for that person, is that they're able to have most of their difficult conversations, they're still able to maintain a congruent stance where they're honoring their thoughts and needs as well as their partners, as well as being appropriate to the context around them. So, and I also just want to take a moment or two to go a little deeper into these Satir communication stances. Like I said, the congruent one is really the model for healthy communication. And each of the other recognizes one of these three different elements I was mentioning, the self, other, or context. And so here you can see the different styles in terms of what they're recognizing and what they tend to be ignoring. And there is some variation in the Satir literature itself in terms of placating. In some cases, they honor the other, only the other, and in others, generally, and then others in context, and ignoring the self in all of them, though. So the context for blamer and placator can shift how much context they acknowledge versus how little context they acknowledge. For example, a good example of a blamer is someone who is launching into a very loud, inappropriate critique in a grocery store of their child for, dropping something. And so clearly there is a blaming stance here, and that's where they're defaulting to, but it's very inappropriate for the context. Versus someone who would be blaming, but in a way they're able to do it in such a way that it's still kind of within the normal behaviors for this context. So the child drops something, and the parent, gives a very, the child drops something, but of course not acknowledging the parent put the child somehow in a context where they would be holding whatever it was, and maybe it's developmentally inappropriate for the child to be carrying whatever they were carrying. And the parent can acknowledge context by harshly setting a limit, blaming, not acknowledging their own part, but it's still, not attracting the attention of people 3 aisles over, versus someone who's ignoring that context, and 3 aisles over they are hearing the parent kind of blame their child. And in some cases, they would be considered the blamer if they are doing this where they've totally acknowledged that they've set this kid up and that they have some culpability for how they have set up their child navigating this grocery store. That was kind of wordy, but hopefully you got some of the images and were able to follow that. So, and it's interesting with the Satir communication stances, and I talk about this in more depth in my books, but I find this most useful when actually thinking about how I am going to communicate to the client and how much of other people's perspectives I need to bring into the dialogue. So for example, at the beginning we talked about, acknowledging different people's descriptions of the problem concern. So when I'm working with a blamer, I will do that a lot because they're very focused on their own worldview, and it's very hard for them to acknowledge the worldview of others, especially when they become upset and angry. And so with someone who tends to go into a blaming stance when they feel threatened, I'm very mindful about consistently bringing up other people's perspectives. In contrast, when I work with someone who tends more towards a placating stance, where they're very quick to recognize the thoughts, needs in others, and it makes them feel at peace inside to know other people aren't angry with them. With those people, I'm very cautious to not give my opinion and to give them multiple perspectives on things so that they're kind of forced to identify and voice what their needs are, what their desires are. And they're put in a position where I don't give them leading questions. I want them to own that their needs, voice them, and learn how to do that in a way that feels comfortable for them. So those are things I'm very aware of in terms of how I communicate with them and how I set things up. For someone who might tend towards a irrelevant stance, those are people who generally need to feel a high degree of safety in order to talk about difficult subjects. And so I'm very careful about how I bring things up, creating a great sense of safety so that they don't have to, jump into irrelevant behaviors because they begin to feel anxious because we're talking about difficult things. So these are very, very useful, I think, to the clinician in particular, no matter what theoretical model you work from, to just consider what does your client tend to do when your difficult conversations come up, because that tends to be what we're doing in therapy and counseling. So knowing where your client tends to go can be useful in terms of making them feel very safe in session to talk about difficult things. So this is the end of part 1, and then we're going to continue on to part 2 to finish up this systemic case conceptualization.